Hello, my name is Sharon Rowe and I'm the Workforce Transformation and Education Lead for the Cheshire and Merseyside Cancer Alliance. In Cheshire and Merseyside, we have a very successful personalised stratified follow-up programme. And this is a programme whereby people who have undergone treatment for cancer have completed their treatment, and those who are less complex are offered follow-up remotely. So when COVID came, we had to pause workshops, and these workshops are offered to people following their treatment to all come together with a clinical nurse specialist and a cancer support worker to have a discussion about what remote follow-up actually means, to talk about signs and symptoms and issues that they should get back in touch with their cancer support worker about, and also a bit of peer support. All these people will have had the same types of cancer and therefore may have similar common problems that they want to discuss. So our workshops were paused and we needed to find a solution for this, because what we had was a backlog of patients who needed that care and that interaction with secondary care, but couldn't be moved on. And of course, they weren't going back to the hospital for their follow-up appointments, and a lot of them were very reluctant to go to their GPs. So I'm just going to share my screen now to show you what that looks like in our area. And this is the quite successful follow-up support that we have in this area, where patients finish their treatment and they begin their journey in remote follow-up. And this means that they have access to self-care and remote monitoring and focused well-being and support by health professionals and a support worker who acts as a key contact for that patient who needs to come back into secondary care or who has any issues. So before we actually register our patients on a remote portal, what we do is we have our workshops. And the workshop itself, as I said, is a healthcare assessment. It's what matters to people. It's about support to actually register onto those health and wellbeing portals. It's a bit of healthy lifestyle advice and things to watch out for, things to be particularly aware of when you need to contact your healthcare professional, and also that meeting place for people to get together to have that support. And this was lacking, so we needed a solution for this. The good news was that in primary care, we were already seeing success with the virtual group clinics. And we got in touch to say, listen, this is really, really good. And we're just wondering if we could adapt some of this to help us with our workshops and get rid of some of this backlog and to move our patients along. And so fortunately, the ELC team and Anna and her team accepted us as a Sentinel practice, and we adapted a lot of their absolutely fabulous materials to our virtual group workshops, which were slightly different from the clinics, but we could use a lot of their learning and some of the resources that they had, like the interactive teaching, which would be really helpful. What we put together was our own workshop without walls, so on our own virtual workshops. And for our staff, who we have brilliant clinical nurse specialists and cancer support workers who work so well in the physical world, having those rich conversations with people. What we wanted to do was transfer all those skills onto a virtual platform. And so we offered these 90-minute live on-training sessions, supported by a really comprehensive step-by-step guide, and these were all adapted from the Sentinel resources that we had, and then as recommended, the offer of a dry run, so they could run through their workshop as many times as they want. They could crash and burn as many times until they felt comfortable and relaxed actually offering the workshop. And included in this was an ongoing patient evaluation. So at the end of the workshop, patients could click on a link and they could evaluate that workshop, because we really needed to know that these were high quality and that they were doing some good for our patients. So the workshop Without Walls, the 90-minute session, was Anna did an initial session which was great on understanding Microsoft Teams functions, but what we found that we needed to repeat this and go a bit slower and do it in a lot more detail. Our staff weren't really keen to engage with the virtual world, so they did need a lot of extra support. And also putting that workshop together in the real world, it ran for about 2.5 to 3 hours with tea and biscuits in the middle. But in the virtual world, we realized we really needed some very lean planning. And so they needed to really have a think about how they were putting those agendas together and to think about timing as well. So post-workshop, our virtual training, I'll do that bit again. Following our training, we actually evaluated the staff, and what we found that a large proportion of them had not used video to communicate with their patients over the last 6 months. What they were doing was they were contacting patients by phone and having these very lengthy conversations lasting up to an hour. So hopefully the virtual workshop where they could see patients, 6 or 7 patients, would actually cut down and be far more time efficient. After our training, our staff felt a lot more confident about actually going forward with the workshops, knowing that the support was always there, knowing that they had those resources. They wanted to embark on these with our help straight away. And what they said about the training was that actually, even though it was a bit scary and they didn't really want to engage, with a bit of hand-holding and a bit of taking things quite slowly, they actually were encouraged to try the workshops. And that's what we really wanted to get them to do, not to back away, but to actually engage and do it. So they found the training very useful, very helpful, and started to embark on the virtual group workshops a lot earlier than we anticipated. And because of that, we've got some great early feedback from our patients. And this is really interesting, and it's also vitally important. What we found was that we had a new audience, so that patients who prior to this would really not engage with any virtual, any social media or anything like that, because of COVID, they had been Zooming away with their nearest and dearest every week or every day if they were really unfortunate. And so a high proportion of them, of an elderly age group, so over 61 years old, were actually engaging with virtual technology. So this was great, and we had to capitalise on this audience, and we will continue to do that. For me, the important thing was the vast majority found the experience excellent or good. And the other thing was that our biggest problem that we thought we were going to have was actually getting them onto the platform. So getting them through that virtual door with a series of clicks. But looking at the feedback, the training was really good, because the cancer support workers and the clinical nurse specialists were communicating how easy this was to do. And so patients were finding the whole experience really good. And a lot of them felt as comfortable as raising issues by talking to people on screen or using the chat as well. And this has been some of the early patient feedback. So again, our patients were finding it a useful alternative. And whereas I don't think anything can replace that gold standard of that face-to-face physical contact, this is an alternative that the patients were pleased about, because it meant that they weren't having to come to hospital, they didn't have to attend their GP, they could have that contact, that vital contact with their clinical nurse specialist to answer questions that may have been clinical in origin. And they also had a cancer support worker there who they could see and who was their first point of call. And that's really important, that you've got that one contact that our patients can relate to. So going ahead, we're now having more and more staff coming on board for the training. We have trained over 100 cancer support workers and clinical nurse specialists. A lot are coming back for refresher training, and that's absolutely fine. And while this is going to be the new world for, you know, a little longer than I think we expected, it's a great alternative and it's meeting our patients' needs. So we're really pleased that we found ELC, and to date it's been a real success.